Tonight, a groundbreaking report from the Lancet, very credible, reveals the deadly impact of air pollution in India. Between 2009 and 2019, 3.8 million deaths, and that's a conservative figure, were linked to PM 2.5, surpassing Indian air quality standards. Shockingly, under World Health Organization guidelines, this number skyrocketed to 16.6 million. I'll explain the difference in the numbers in a moment, but what is PM 2.5? Remember, these are the particles which, as a result of air pollution, when they do spread, they stay deeply lodged in your lungs and they cause the maximum damage. It results in lung disease, it results in cancers, it results in a host of ailments, right? And it's something that impacts millions of people in our country. Now, the Lancet study underscores the critical need for stricter air pollution controls in the world's most populous nation, our country. Based on Indian and national ambient air quality standards, 3.8 million deaths were attributable to PM 2.5 exposure between 2009 and 2019. So, first up, these are the Indian standards, right? So, 3.8 million deaths as a result of PM 2.5 in this decade. But when using World Health Organization guidelines, the number of deaths attributable to PM 2.5 exposure rises dramatically to 16.6 million over the same period. Now, the World Health Organization recommends an annual mean PM 2.5 concentration of 5 micrograms per cubic meter, while the Indian standard allows up to 40 micrograms per cubic meter, highlighting that significant discrepancy in acceptable pollution levels. Why is there that discrepancy? We'll talk about that in a moment. 81.9% of India's population lives in areas exceeding the Indian standard of 40 micrograms per cubic meter. If you look at the World Health Organization standard, it's almost 100% who are exposed to PM 2.5 levels at levels which are unacceptable. Why? Because an increase of 10 micrograms per cubic meter in PM 2.5, according to Lancet, was associated with an 8.6% higher annual mortality rate. Bhavreen Kandhari joins us now, and I'm also joined by Dr. Ashish Jain, Director and Head of Respiratory Medicine and Pulmonology at Max. Bhavreen, let me come to you first. Is there not an urgent need to reconcile what the World Health Organization considers a quote-unquote acceptable level of PM 2.5 exposure and Indian norms, which are 8 times higher than the WHO norms?
Yes, Vishnu, absolutely. These figures are, it's not like we're hearing them for the first time. It's being said, over and over again. 1.5 million lives. It's something to really be, it's shocking. Our children are going to live 4 years average. India and Delhi, it will be about 12 years lesser than, any other child in a cleaner air city or country. So this is absolutely shocking that we're in a denial. I must emphasize that even recent consecutively for the 4th year in the Parliament, the Ministry of Health very clearly said that they do not see any connect between air pollution and the death. So this is where the problem is. When we say there is no political will, this is what it is. When there's denial, that is the most dangerous game that we are playing. Because if we accept, only then we will be able to solve something which is, going to cost our children their health, the future. This economy. It's about 1.5 million lives, and it's about 95 billion dollars annually, which is roughly 3% of the GDP, which is lost in
so there's an economic cost in addition to the loss of lives. But Dr. Ashish Jain, now that we have numbers, right? The key point and we're talking about lives over here, not just the economy and other factors. Does this make sense to you on the basis of the number of cases that you've seen over the last several years? In the past, we used to say a person has died of of cancer or of cardiac arrest or of a kidney ailment or of a stroke. But now we have a number which says the WHO statistic, more than 16 million people in a decade have died of PM 2.5 alone. We're not even talking about PM 10, right? What does that say to you?
Hello, Vishnu. Good evening. And you have really picked up a very, very serious matter right now. Now, as you rightly said that, there are patients who were dying with the cancer and with COPD and heart ailments and other things. But let me tell you that this PM 2.5 and PM 10 and all the other pollutants, which they actually affect the lungs and various other organs of the body and ultimately result in cancer, or they result in cardiac arrests or heart ailments or lung ailments, stuff like this. So ultimately patients are dying because of these illnesses. But what they have found in this Lancet study, which you are quoting just now, is that the increased incidence of these cancers and cardiac ailments and COPDs, which are leading to patient's death, is because of this increased pollution. And as far as your question is, yes, we are seeing increased number of patients attending our OPD. We are seeing increased number of patients gradually increasing. I am practicing here in Delhi since 2010. And I can see that year on year, there is a constant rise in these COPD patients. We are finding it difficult to give them a symptomatic relief. We are finding new patients coming up with cancers, younger patients, those who are coming with cancers. And all this while we have been just talking that, this is probably attributable to the pollution. And now we have the data, Indian data with us.
No, exactly. And there's Indian data and there is WHO data. And Bhavreen, I think this is an important point that, why should we not accept the World Health Organization's data, bring down our standards? Are we in denial about the true number of people who are dying? Why is it that people are valued more for their lives in another part of the world and valued less over here?
Absolutely. And Article 21, Vishnu, clearly this is our and our children's right to breathe clean air and clean water. This is their birthright, and it's being taken away. Also about the AQI standards, which have been updated by WHO to about more than 2 years ago, and we haven't done that in India. So the numbers that we are getting right now would be probably much lesser, because the air that we are thinking like today maybe moderate is not moderate, because when you update the AQI standards, that will become poor, and poor could become very poor, and very poor could be severe, and severe could go to another level. So this is again another form of denial, something that's being asked for more than 2 years. Citizens have gone up to the Central Pollution Board, and they've requested, they've been writing to them. There has been small campaigns like sending postcards, etc. About 10,000 citizens wrote to the Pollution Board requesting that they must update. So why is this delay? Because this delay is also another form of denial. We're trying to conceal the reality. I mean, we want to say the air is moderate and good. Yes, we want to say that, but we don't want to lie. That's a very big difference. So again, this is extremely important, and that is, like I said before, it's going to happen only if they will think like it's all our
Bhavreen,
children.
just give me half a second
politicians.
since I've got only a little time left. Dr. Jain, we've all gotten tired of wearing a mask because of COVID. But we wore it diligently because it was mandated on us. How important is it to wear a mask for citizens across large parts of India this time of the year?
See, Vishnu, it is very difficult for anybody to wear mask 24/7. If you're talking about the outdoor pollution, let me tell you, and you'll be surprised that the indoor pollution is far bigger threat than as compared to the outdoor pollution. The same air is coming inside your house, but inside the house, there are danders, there are perfume, there is mosquito coils and the incense sticks and cooking fumes and whatnot that is adding to the pollution. So if you think that you will be safe by wearing a mask outside when you're going out, think about staying at home, right? So mask is definitely not a solution. I've been telling this in various forums and to my patients as well. You know, when you're visiting a visibly dusty and polluted area for that period of time, you can wear a mask, but otherwise it's not possible. The commercially available masks that we, 3-ply masks that we wear, are hardly of any use. You know, after
Sure.
some time, because of the humidity of our exhaled air, they become soggy
No, I
and they
think, Dr.
become
Jain, you
ineffective.
raise an important point. I'm afraid I'm completely out of time on this program, but I think that data is absolutely shocking. We will continue, as
But
always, on this program.
Vishnu, just sorry I'm interrupting you, but just one point that I must make here is that we have been saying, you know, the panelists are saying that, you know, we are living in denial. I think this is not a denial. This is just a complacency. Sab chalta hai attitude. क्या फर्क पड़ता है attitude? You know, if I can afford, I will have a air purifier at my home. If I can afford, I'll you know, go to London or
Dr. Jain,
Switzerland or shift over there.
I take your point entirely on the complacency.
Yeah.
Completely out of time. We'll revisit this topic. We're out of time on left, right, and center. From all of us here, good night.